In this unit, we're going to look at overweight and obesity. We'll start with some definitions of overweight and obesity, as well as talk a little bit about some contributing factors and potential health consequences of overweight and obesity or health risks. And then we're going to move into information on diet, exercise, and behavior modification to help with weight control. As we look at how we define overweight and obesity, I think it's important that we think about some of these strengths and limitations with measuring overweight and obesity. So we'll shift in just a minute to body mass index, or BMI, which you're probably quite familiar with in terms of how that's used to define overweight and obesity. You also have probably already been exposed to thinking about the strengths and limitations of using body mass index, but I think this can't be emphasized enough, because although that is what is used for diagnostic criteria for overweight and obesity, there's significant limitations with using BMI for individual people. BMI works great when we're looking at populations, so large groups of people, because on average, people who have a higher BMI also have a higher body fat, but that's not always true for an individual person. So it's really important that although we use BMI for cutoff values for defining overweight and obesity, we recognize the limitations on that. And as nutrition professionals, we really need to think about what other elements of assessment we use to determine whether the body weight that an individual person is carrying is potentially harmful or maybe is perfectly fine for their body. You know, even though it perhaps falls in an overweight range, for example, according to BMI. So just kind of keep those strengths and limitations in our definitions in mind. So the definitions, this table has the various weight classes and again, the body mass index. So underweight is less than 18.5, currently normal, and I have quotes on that because normal, you know, it can be different for different people, but what's kind of considered a normal or healthy body weight is our body mass index is a 18.5 to 24.9, with overweight being in the 25 to 29.9 category. And then obesity is over 30, but there's this class 1, class 2, and extreme obesity. This kind of starts to recognize that the higher the body mass index, the more health risks associated with that. So it's broken down into a little bit more more specific than just over 30 to help capture what risks might be associated with that. When we talk about health risks with any condition, again, another thing just to keep in mind is we're talking about risk, which means it doesn't say that everyone who is obese will develop certain conditions or that sort of thing, but it just puts them at higher risk. So it's something for us to at least look at and assess a little bit further and determine whether an intervention is warranted. So these are important categories, cutoff values to be familiar with, because they are what define overweight and obesity currently. I will say, while we're on this topic, that there's some question on these, particularly in that overweight range, whether that's really appropriate based on how it impacts, for example, mortality. So do people in this weight category, you know, is it better with mortality or morbidity, things like that. And so it may be that these classes change somewhat. It also changes as people age. So older adults really do better if they're in that sort of overweight range as opposed to the normal weight range, again, on average. So it just kind of shows us that probably what's healthy and normal for our bodies varies as we are at different stages in the life cycle, among other factors. So I just wanted to kind of highlight that. When we look at classifying weight in children, we do use body mass index, but we don't use it in the same way we do for adults. So for adults, you just saw there's just a specific number range for body mass index that defines underweight, normal weight, overweight, and obese. For children, we use the BMI, and the calculation for calculating BMI is the same. However, then you will plot it on a growth chart for the child, and there's a body mass index growth chart for children, and then we use percentiles for defining overweight and obesity in children. So between the 5th and 85th percentile is considered, again, quote unquote, normal for children. Underweight would be less than that 5th percentile. Between the 85th and 95th is now considered overweight. It used to be defined as at risk for overweight, and then over the 95th percentile is now considered obese, and again, previously defined as being overweight. So some issues, some different changes in the cutoffs here. One thing with kids too that's really important on those growth charts is that you look for trends. So if the weight, if a child has been, for example, right on the 3rd percentile, but they keep just tracking right on that 3rd percentile, or you're very close to that, that may be that's just a small child, and that may be normal for them. What we really want to watch for is jumps or drops significantly on the growth chart. And again, if a child falls in this overweight or obese range on the growth chart, it's really important to think carefully how we talk to families about that, the terminology we use. These terms, overweight and obese, are used clinically. It doesn't necessarily mean you necessarily want to use those words with parents and families. So this is an area that I think it's really important to think about, how you talk about this and what does that mean, and is that weight a problem for that child, or is that maybe a little bit closer to what's normal for them? So just important to look at it in the context of a comprehensive nutrition assessment, and being very careful with children, because it's very easy with kids to be overly aggressive with weight loss if they're on this kind of on the edge place, and it can sort of backfire. So just a touchy area. When we talk about overweight and obesity, obviously we're talking about it because there seems to be risks of having that excess body weight. So it's really important to think about what are those risks. Again, it's not saying that everyone who is overweight or obese is going to develop all these conditions, but having that extra body weight on average does make it more likely that someone's going to develop the conditions, some of these conditions listed on the screen. And I do have excess body weight there on the top, but really it's, for the most part, it's excess fat weight that tends to cause the risk. So if someone is a high body weight but very muscular, very dense bones, sometimes that contributes a little bit, although typically not super significantly, but it's really those kinds of things aren't so problematic. It's really the excess fat weight that tends to cause some of these issues. So coronary heart disease or coronary artery disease, hypertension, which of course is high blood pressure, type 2 diabetes, and with that type 2 diabetes, really that insulin resistance is a huge factor in that is aggravated by excess body weight and large fat cells. Gallstones can be there's a higher risk of having gallstones for someone who is overweight or obese, breathing problems, and then some types of cancer, although not all. And I think that area is a little mixed in the research. Sometimes hard to say how much the weight itself contributes to risk. But these are some categories that some health conditions that having extra body fat increases the risk for. So when we look at treatment for overweight and obesity, really the cornerstone of weight control is diet, exercise, and behavior modification. In this week, in this topic area, we'll also be looking at medications for weight loss, so pharmacological approaches, as well as surgical options for weight loss. But even if someone is appropriate for medication and or surgery, diet, exercise, and behavior modification still are an important part of weight loss. So the medicine or the surgery isn't going to totally fix it in and of itself. So these are really the cornerstone, regardless of whether or not something else that's a little more aggressive is added on. So what we'll look at in the rest of this lecture is really thinking about diet, exercise, and behavior modification, if it's really the only part of weight loss, not really considering combining it with medication or surgery at this point. We'll look at that in a separate lecture. So the foundation of weight management, again, diet or food, obviously that provides the calories that are going to contribute to either weight gain, weight maintenance, or weight loss. Physical activity is really important for long-term, particularly for maintenance of weight long-term. And behavior modification is looking at how to change habits and behaviors surrounding food, physical activity, as well as other issues perhaps, such as sleep, stress management, and those types of issues, which more and more are being recognized as really being critical to weight control. Sometimes we really focus on the diet and exercise, which are certainly important, but there's definitely research showing the impact that sleep can have and excess stress can have. So those are important for people to consider as well when they're looking at weight control. So in terms of weight loss goals, general recommendation for sustainable weight loss is about 1 to 2 pounds per week. Even a half a pound a week for when we're looking long term is okay. That can be very discouraging for people because it's not typically what people have in mind when they embark on trying to lose weight. They're really probably thinking they're going to lose more weight more quickly than that. The issue with losing weight too quickly is often people have to do more drastic things to lose that weight. So that's one aspect of it. And those drastic things tend to be less sustainable for long term than more modest changes in life. The other issue is the more quickly we lose weight, the more likely it is that we're losing more muscle mass as opposed to more fat mass. With any weight loss, usually there is some muscle loss, not always, but it's very common to have some muscle loss with weight loss. But if we can slow the pace of weight loss, then we generally minimize that. Losing 10% of body weight, there's different percentages you'll see out there, but 10% is kind of a common range that when someone who is overweight or obese and has risks of certain health conditions based on that, losing 10% of their body weight decreases that risk and often can improve some of those conditions if they have them. So for example, if someone has hypertension, high blood pressure, and they are obese, a 10% weight reduction is likely to show improvement in their blood pressure. So that's a great goal. Again, sometimes that's not as much as people would like to lose, but this is where we really want to talk to people individually about what their goals are, what's realistic, what's sustainable, and really I think helping people sometimes shift towards thinking about this for the long term. So it's not just about what we can lose in the next month or two, but how long we can maintain that and really keep that off, which obviously the goal is that whatever weight is lost stays off permanently. So often slower helps with that. Something else, so I was thinking with that and not remembering. So this is kind of the standard weight loss goals. Now I will say if someone initially loses more, initially it's not a huge problem and it's not uncommon. One thing too, if someone, we know now that obesity is a really inflammatory process in our body. So fat cells aren't just sitting there doing nothing, but they are really pro-inflammatory. And so if someone has that pro-inflammatory state and they start making shifts and losing weight, that's typical that there's it's not uncommon for there to be quite a bit of water loss initially as that inflammation starts to decrease a little bit. And so sometimes that initial weight loss will be more quick, which usually people are happy with that too, and not cause for concern. I wouldn't worry too much if it's more than that 1 to 2 pounds a week initially, but it is helpful, I think, to let patients or clients know that that likely won't continue long term. That initial weight loss tends to be a little bit more rapid. And again, individual differences certainly apply. Some people lose weight more quickly than others. But the main thing is to watch that someone isn't making such drastic changes that it's not sustainable, because that's not going to be ideal for them long term, and that they're getting adequate calories to meet basic nutrient needs. So how do we calculate calorie needs for someone who is wanting to lose weight? Now, with weight loss, there's a lot of different ways to approach weight loss, and I'm not necessarily saying that everyone needs to count calories when they're, if you're working with someone on a weight loss plan. I think there's many things to support that. Counting calories for a lot of people is doesn't work as well. They just don't want to do it. It's difficult to do, and there's certainly some other strategies. However, as the nutrition professional, sort of helping this person decide what to eat, it is helpful to have sort of a ballpark about how many calories they will need. So you'll want to be able to calculate those calories. Calculating calorie needs is difficult because none of the equations that we have are totally precise. So I would encourage you to use these as a ballpark. They at least get you in the range of what's probably going to help someone lose weight, but you don't have to get super detailed and nitty-gritty on the actual calorie because the equations are estimates. So the recommendation from the Academy of Nutrition and Dietetics Nutrition Care Manual for overweight and obese individuals is to use the Mifflin-St. Jeor equation to calculate the resting metabolic rate. And then you would use that as a base. So again, that's resting. So that doesn't include activity level or even higher, a basic activity like activities of daily living, so just kind of moving around, living, breathing, those kinds of things, or a higher activity level if they're adding exercise or they do exercise regularly. There are mixed recommendations on this physical activity factor. So you'll see here there's the Mifflin-St. Jeor equation for men and women, and then below I have to multiply that result by 1.3 for sedentary individuals and higher for increased physical activity. That is a little bit, there's some mixed things out there, whether that really should be 1.3, whether that should be less if they're sedentary. So again, open to a little bit of interpretation. That would give you, that calculation though, would give you their maintenance calorie needs. So then for weight loss, we would want to reduce that intake a little bit to achieve weight loss. The typical recommendation is to reduce calories by about 500 to 1,000 calories per day. And that's based on the premise that about a pound of body weight is about 3,500 calories. That, I will tell you, we use that a lot, and I will still use it in this class as a ballpark, but there actually was a recent publication that came out that really demonstrates how that's not all that accurate, but at least, again, it's something that gives us in the ballpark. So if we're saying 3,500 calories is about a pound, and we reduce, for example, 500 calories per day times 7 days in the week, that would give us a 3,500 calorie a week reduction, which is about that 1 pound a week that we're looking for. Or if we double that to 1,000 calorie a day reduction times 7 days, that would be 7,000 calories for the week that we reduce, leading to about a 2 pound weight loss. Again, it's not totally precise, but at least it gets you in the ballpark. That doesn't account for any increased physical activity someone's doing. So if they add exercise in, that's also going to help utilize some of the calories that are being eaten. So that's kind of, you'll want to be familiar with some of the ways to calculate calorie needs for people who are overweight or obese and trying to lose weight. If someone is very obese, like severely obese, these equations tend to really overestimate their calorie needs. So I think it's also one of those that you have to kind of use a little bit of judgment on, and if the calorie needs are really high, to probably reduce that somewhat if someone is trying to lose weight, because even for someone who's very large, to go, some of these might come out to 3,000 or 3,500 calories. That's probably going to be too high for most people to lose weight on. But if their caloric intake has been much higher than that, then it might. But for most people, that's not going to achieve weight loss. This is a table of a more sort of quick way of calculating calorie needs rather than that Mifflin-St. Jeor. Again, the Mifflin-St. Jeor is kind of the standard or recommended, but this is a much easier, quicker calculation, and it gets you very close. So I think this is also very handy. That would be a nice little table maybe to have, in your references, in terms of a quick way to calculate calorie needs for someone who wants to lose weight, maintain weight, gain weight, and then based on sort of a low, moderate, or high activity level. And the source for this is on the slide there as well. So then when we look at actual specific diet interventions, one option is low-calorie diets. So a low-calorie diet would be defined as about 1,000 to 1,200 calories per day for women and 1,200 to 1,600 calories per day for men. On average, these are calorie levels that for most people will promote weight loss. Those are pretty low. That's not a lot of food. So it takes really carefully planning the food so that someone feels full. Because if those calories are coming, for example, from very highly processed foods, it's probably not going to be enough to help them feel full. So it's really important to be looking at foods that promote satiety, like high fiber foods, adequate protein, so that the person can feel relatively satisfied on this lower calorie level. Certainly you could go up from that, but of course the weight loss will likely be slower. Very low calories, a very low calorie diet by definition is less than 800 calories per day and really should only be done under medical supervision, because once you get below about that 1,000 to 1,200 calories per day, for one, it's pretty much impossible to get all of the nutrients, the vitamins and minerals your body needs in that low of calories, and you start to have some other potential metabolic issues. So it's really should be only done under medical supervision if someone's doing this very low calorie diet. And often those will be done with some type of a medical food type thing to be able to get the calories in. The note a calorie deficit at the bottom is kind of what we just talked about with trying to reduce caloric intake by about 500 to 1,000 calories per day. So we talked about on the last couple of slides how to calculate estimated calorie needs for someone. Another way to approach it is if you can get a pretty accurate diet intake for them, so you can calculate about how many calories per day they're currently eating, then you could take about 500 to 1,000 calories per day off of that. And again, that should promote about 1 pound to 2 pounds per week of weight loss. So if you collect diet information and someone is eating about 3,000 calories per day on average, if you could even get them down to about 2,000 calories per day, that's above what the low calorie diet at the top of this screen shows, but it should be enough to promote some weight loss for that person. So that's just kind of another way to approach what type of a calorie reduction could be done. When we look at diet interventions, so food interventions for weight loss, there are a variety of things to consider. One thing is the macronutrient mix. So basically that's saying what percent of calories from carbohydrate, protein, and fat. The AMDRs, if you remember, is the acceptable macronutrient distribution range. So these are just standard for anybody. These aren't specific to weight loss, but even on a weight loss diet, staying within those ranges is generally recommended. Now, there are some diets that will change this a little bit. For example, some of the lower carbohydrate, higher protein diets, even something like maybe like the South Beach diet in the more maintenance phase, not the initial phase, but sort of the maintenance phase, is probably closer to 40-ish% protein and takes carbs down to probably about 40% in that kind of a range, that type of diet. Something like some of the very low fat diets like Dean Ornish is going to be on the very low end of fat and emphasizing some of the complex carbohydrates, but very low fat. So there are some modifications to these AMDRs that certainly have some support that they can work for people and maybe better in different health situations. For example, individuals with insulin resistance often do better on the lower end of carbohydrates and sometimes even below that 45%, although I would caution against going too low, because if you go too low on the carbohydrates, you start to not be able to include foods that are very rich in nutrients like fruits, vegetables, especially the fruits, whole grains, some of those types of foods. So that's one consideration in the diet part. Another piece is the fiber. Definitely adequate fiber per day. Fiber is satiating, so it makes us feel full because it's bulky, but our body doesn't thoroughly digest it, and so that helps give the bulk and helps give the fullness without a lot of excess calories. Really important to have adequate fluids. Often people think they might be hungry when really maybe they're thirsty, and staying adequately hydrated generally helps people feel better overall, which helps them with staying with diet changes that they're making. So really important to have adequate fluids, not too much caffeine, water is ideal if they can be drinking water during the day, but if it's not water, helping them come up with other fluids that don't provide excess calories. And then frequency of eating. It's important with weight loss when people are trying to lose weight. If they go too long of stretches without eating, it's much easier to eat high calorie and particularly high carbohydrate foods, because when our bodies get very hungry, the body knows that that's the quickest source of energy, is those carbohydrates, particularly refined carbohydrates. So it's easy to have those food cravings, and it's easy to overeat when someone gets too hungry. The other thing is, we know when we eat, it stimulates our metabolism and kind of keeps things, keeps our body using those calories, which is what we want when we're trying to lose weight loss. So the rule of thumb I give people is generally, for most people, about every 4 to 5 hours works pretty well, because that's about how long it takes our body to digest and process food, typically. So by eating about every 4 to 5 hours, that usually kind of maximizes that metabolism. It helps prevent getting overly hungry and helps prevent overeating. For most people, that means about 3 meals and 1 snack a day. Some people prefer to eat a little more frequently. I caution people about eating too frequently, because if they're just kind of grazing or nibbling throughout the day, it's easy to get in more calories than a person realizes by doing that. So if they want to have more snacks, certainly can do that, but then it's important to really reduce the portions, even at the meals. So really kind of looking how that works for someone. But in general, about every 4 to 5 hours typically works fairly well. So now shifting to look at physical activity. This is certainly an important part of overall health as well as weight management. However, physical activity is more related to and more predictive of weight maintenance than weight loss. So it's important to help people work physical activity into their life and into their pattern, so as they lose the weight, they will keep that off. The reason that it tends to not promote as much weight loss as the diet part does initially is it's just difficult to burn enough calories with physical activity to achieve that 500 to 1,000 calories a day on a consistent basis for most people who are in the category of needing to lose weight. Now, if someone's already highly active and they're training for marathons and doing that kind of thing, they're burning a lot of calories, but that's not the type of person who's trying to lose weight. And so usually when someone's trying to lose weight, they're not active at that type of a level. So general recommendation for physical activity is to reach about an hour a day on most days of the week. Now, for weight loss, if they're really trying to use more exercise to lose weight, they're probably going to have to even go a little bit higher than that. But that's where combining the physical activity along with the changes in eating patterns and eating habits typically works better for most people than just only trying to use physical activity for weight loss. Or it's just going to be much slower. Gradually increase physical activity. So again, really look at where someone's at, what they're able to do initially, and how to just gradually increase that physical activity. I think it's helpful for people to remember all movement that burns calories helps. So all of those little tips and tricks, like, taking the stairs instead of the elevator, parking in the far corner of the parking lot when you go to the grocery store or to work, all of those types of things just to increase movement in any way, it all can add up and all can help. Some people really enjoy, using like a Fitbit or those kinds of things to track those steps, because it helps see when they're increasing those just sort of daily activity movements and walking more and that sort of thing. So sometimes those kinds of tools can really help people, can also help them sort of assess where they're initially at and then see improvements or set goals for themselves. Increasing muscle mass can help increase basal metabolic rate. So remember, basal metabolic rate is how many calories our bodies burn when we're just sitting doing nothing, essentially. So what it takes just to keep the heart beating, the brain functioning, those types of things. So anytime we can increase that basal metabolic rate, that's great in terms of weight loss, because then we're burning more calories just sitting there. So exercise can help with increasing that muscle mass, but it sort of helps over time. It typically takes a little bit to build that up, but that is definitely a benefit of physical activity. And in terms of what type of physical activity, really balancing the cardiovascular training, strength training, and flexibility exercises to sort of think about overall health and fitness, and also reduce risk of injury, which is important. Again, my last bullet here is, I think, important that exercise is really more predictive of weight maintenance than weight loss. And I think it's important for people to know that, because it can be very discouraging if they're working really hard to embark on a new exercise pattern or physical activity pattern and they're just not seeing the changes in weight. That can be really discouraging. So supporting them, really emphasizing and reminding them all of the health benefits of physical activity, and that although the weight loss may seem a bit slower, that physical activity is going to help maintain that weight loss. And then perhaps if they aren't looking at diet and food things, also really helping them look at maybe small changes they can make in the food that could really start to speed up that weight loss a little bit. The last category we'll look at today in this lecture is behavior modification. So when we talk about behavior modification, we're talking about what sort of tools and strategies help people change those habits or behaviors. So three general categories that I have listed here. One is stimulus control. So the words probably kind of are self-explanatory to some extent, but helping someone identify the things in their environment that stimulate them to have the behaviors that they're trying to change. So for example, if they have a candy dish on their desk and they know that that candy dish is easy to just dip into, then maybe taking the candy dish off the desk. So that's a stimulus in their environment. If when they go to the break room at work, there's always donuts or pastries or whatever, and that really is a trigger for them. Maybe they want to take their break somewhere else. Maybe they want to take their break and go for a little walk. It's kind of a double bonus there. But helping people identify things in their environment that stimulate them to either overeat or under-exercise or other types of behaviors they're trying to change, not get enough sleep, any of those types of things, and then help them modify their environment and those stimuli. The second category is rewards. So this is kind of one of those basic human things that people tend to do things for rewards. We change behavior based on rewards. In school, grades are a classic example. Your grade is kind of your reward, and you work hard because that reward is at the end. So rewards also can work in changing food and exercise behaviors. It's kind of important to help people sometimes think about in what ways they're rewarding themselves. The reward should match the, endeavor. So if someone exercises for 2 days, they probably don't need to buy themselves a trip to Hawaii. That's kind of a bigger reward. So kind of thinking about matching that reward so it's meaningful, and also helping people think of non-food rewards. So I would not encourage to say, I've been quote unquote good all week, so on Friday night, I'm going to go out for ice cream. If they want that to be part of their eating plan, great. But I would try and get away from rewarding with that and more look at it just that's a pattern of what they want as part of their eating plan. So really looking for those non-food rewards. And then the last category, self-monitoring. This is things that help you with more awareness or a person more awareness of what they're doing. So this would be things like keeping a food journal or an exercise log or those types of things. When we self-monitor, it helps us really be realistic about our behaviors. It's easy to kind of not realize what we're doing, what we're eating, how we're moving, those kinds of things. But when we write them down, that can be really helpful. And there's studies out there that have shown even when someone is not, again, on average, but when someone isn't prescribed per se a specific diet or eating plan, but they simply keep food journals, they tend to lose weight. And so a lot of that has to do with when we become aware of what we're eating, sometimes that in and of itself changes our behaviors. We may only have 2 cookies instead of 6 cookies if we know we're writing it down, things like that. So that's self-monitoring. So these are sort of 3 broad categories of behavior modification that you can use to work with people to help them make the changes that they want to make in their eating patterns and exercise patterns. This last slide, there's a link at the bottom that's from the National Heart, Lung, and Blood Institute, which is part of the NIH. And this it's called a practical guide, but it has these various appendices that I think are just nice kind of information, very basic and straightforward, but kind of, I guess, tricks, tips, and some logs and things like that that I think can be useful tools. So maybe something to make a note of, to have some of those tools available. So just kind of a quick summary in this, looking at definitions of overweight and obesity, how we define that, and what are some of the limitations in how we define it. Thinking about some of the potential causes and contributing factors to overweight and obesity, as well as the potential health risks or consequences of overweight and obesity. And then thinking about diet, exercise or physical activity, and behavior modification as really the cornerstone to treatment, and specific types of things that you would want to integrate in for someone who is trying to embark on a weight loss program.